Yeah, so hello everybody, good morning. Myself, Dr. Anshu Warade, consultant neurosurgeon from Fortis Hospital, Vashi. I am an endoscopic brain and spine surgeon trained in Italy and skull base and neuro-oncology neurosurgeon as well, of the training of which I have done from Istanbul, Turkey. So today, the topic of our discussion is endoscopic brain and spine surgery. So which is also known as minimally invasive brain and spine surgery and keyhole brain and spine surgery. So why it is called keyhole surgery? Because the incision required for these surgeries is of the size of literally keyhole. So that's why they are called as keyhole surgeries. So this endoscopic brain surgery can be broadly generalized, classified into transcranial and transnasal approaches. And in transnasal approach, there is not even a single cut. The whole brain tumor or the intracranial pathologies can be completely treated with the help of endoscope without any cut through the transnasal approach. So the idea behind endoscopic surgeries is to cause less tissue damage, less pain to the patient, and to provide better cosmesis. So in brain pathologies, if we broadly see, the common pathologies include pituitary tumors, which are the tumors of the pituitary gland, which produces hormones required for the activities of our daily routine activities. Yeah. Then these tumors are basically based in cellar and supracellular region. They arise from cella, which can be approached through the nasal cavity, and without any cut, we go in through the nose and can remove the tumor without causing any cuts or any stitches to the face or anywhere. So the other pathologies which includes anterior skull-based meningiomas, which are the tumors which arise from meninges, which are the coverings of the brain. So these meningiomas include olfactory groove meningiomas, tuberculum celli meningioma, planum sphenoidal meningioma, and diaphragm celli meningioma. So all these meningiomas, which are the tumors of brain coverings which arise from the anterior skull base, can be removed through endoscopic approach, which doesn't require a single cut. Through nose, we can remove it through the endoscope. So we have all the endoscopic facilities now through which we can remove these tumors. So other pathologies basically includes craniopharyngiomas, clival tumors, and excluding these tumors, the pathologies like CSF rhinorrhea, in which there is skull-based defect. So if we find there is a skull-based defect at olfactory groove or somewhere else in sella or in other part, so we can go in, patch the defect, and stop the CSF leak all through the endoscopic approach without any cut. So other pathologies include intraventricular tumors, which requires a very small cut because it involves brain transcranial approach. So that's why a very small cut is required, like a keyhole approach, and a small burr hole is placed, and through the burr hole we put in a scope and we remove the brain tumor, intraventricular tumor. Pathologies like hydrocephalus, in which the brain ventricles are enlarged, they can be treated with the help of endoscope. So, with the help of endoscope, we create a new pathway which creates a new CSF circulation inside the brain itself, so that there is no need of any foreign body like VP shunt. So, this is the use of endoscope in hydrocephalus. So another use of this endoscope is in treating pathologies like trigeminal neuralgia, where a very small shaped keyhole shaped and a coin shaped small craniotomy can be done is done, and the fifth nerve is identified, and where the vascular loop which is indenting the fifth nerve is gently separated off the fifth nerve, and the Teflon patch is placed, and the neuralgic pain is completely gone, and this involves a very small cut and a very small craniotomy. So this was all about very few indications of brain. and we will now discuss about spine endoscopy as well. So in spine endoscopy, the indications are, we have a lot of indications, but we'll discuss a very the commonly done procedures like lumbar disc herniation, which involves very small cuts in the spine, and the disc can be removed through a very small cut, say for about a centimeter. So through only 1 centimeter incision, we can remove all the lumbar disc, and the patient can go home within 24 hours of the surgery. So another indication is where there is listhesis, listhesis in the spine, lumbar spine. So if the vertebrae when they are not aligned and there is sparse fracture, the vertebrae are the basically there is listhesis. So the upper vertebra and the lower vertebra, they are not in the line. So this causes pain in the back pain. So these vertebrae needs to be aligned with the help of stabilization procedures. So these stabilization procedures can again be done through very small incisions, where the pedicle screws can be put through very small incisions, and the spine can be aligned and it can be fixed with the rods and screws. So this is another indication. And in the spinal tumors, which include intradural tumors like intradural meningiomas, intradural schwannomas, neurofibromas, all these can be done through with the help of endoscope. Through a very small incision, we go in with a very small hemilaminectomy. The dura is opened, and the tumor is approached, and the tumor is completely excised, and the dura is stitched, and then there is no cut, there is very small cut which is closed with absorbable suture, so there is no need for the patient to come for suture removal. So this is all about endoscopic brain and spine surgery. So I have just discussed very limited indications, but we have a very broad list of investigations which can be done through this endoscopic brain and spine surgery approaches. So thank you very much. And if you have some questions, you can put it in the comment box. I think there are no questions. Yes, Prasanna. Okay, thank you very much. Thank you for your time. Thank you.